Center, which is aimed at bringing healthcare services closer to the community. The Patient Care Center is aimed at connecting patients with our healthcare, answering to queries, and providing support. So as a board, this is a testament to the commitment of our county government towards delivering quality care and patient-centered services. As a board, we're really grateful to the County of Mombasa for championing this initiative, and we do believe it is a game changer. To the team that will be manning the center, you are the backbone of this service. And we believe that your energy and your passion will drive this whole initiative towards success. So as a board, we urge you to be empathetic, to be responsive, to be proactive, and to be that voice of care, that voice of compassionate care, and to remember that every call counts. So as we mark today's launch, we count on you to make this a success, and we wish you all the best. Thank you very much.
So thank you so much. So allow me to invite our CC so that she can be able to invite the governor.
Habari tena. It's an honor and a pleasure to invite His Excellency the Governor to address us. Thank you.
Let's stand.
Kaini. Let's sit.
Okay, you can sit.
Assalamu alaikum. God is good and all the time.
God is good and that.
I'm going to try and be brief because we cannot have a hospital without the people who we are launching here today. They need to be at those hospitals manning and doing what needs to be able to be done. But at the same time, Mombasa County is one of the counties in this country that receives the highest number of patients in comparison to others. The Coast General Hospital, where we are right now, has about 1,012 employees. Out of the 1,012 employees, almost 730 employees are paid their salary by the county government. Then the remaining is what is paid by the facility from the revenue that they're able to retain. Every given day, because of the fact the county government believes in an activated workforce, in a motivated workforce, every single day we receive hundreds of interests, people wishing to be able to work for the county government. The salaries that we pay just for the staff in this hospital are about 1 billion shillings annually. 1 billion. And that is not even from the revenue of the hospital. That is from the revenue of the county government through other sources. From the parking fees to what others say is equitable share. And these figures don't stop. They increase. We have some of the best workforce in this country. From doctors to nurses. When you look at the qualifications, we have amongst the best, including consultants. We have amongst the best facilities, equipment-wise. We have capacity to be able to grow. Even right now where we're standing, this oncology center here is amongst the best in the country compared to both private and public facilities as well. We equally have amongst the best goodwill in partners. Goodwill from those who wish to be able to assist us in equipment, goodwill from those who wish to be able to assist us in one way or the other. And every day we are signing new MOUs in which we can be able to grow our hospital. But one of the things that we lack in this facility is that word empathy. For people to feel that they're being treated like a human being. People to feel that for them to walk into Coast General Hospital is a place where they're actually finding solace, comfort for their healing bodies. Now we cannot be able to boast that we have all these things here where if a poor person was given opportunity, they would choose not to. If a person had the capacity to be able to be told, choose, you need to ask yourself, how many would actually say that yes, we have amongst the best doctors, we have the best consultants, we have the best equipment. Yes, we are willing to be able to go to Coast General Hospital. And it is for that reason why we are here today. I made this promise that we need to be able to launch a truly nothing else but your job is just to the MombasaCare team that we are launching here today. Your job is just to look at the interest of that patient. Has that patient felt that level of confidence? Have they felt that yes, because when someone first of all is comfortable and someone feels that they're being treated with dignity, that in itself is a healing process. When someone comes to a hospital where their stress levels end up being higher, it doesn't augur well. The MombasaCare team, I have insisted that their job should be not to sit on a desk. You need to walk to the wards, talk to the patients. A template will be provided for you or to you, where in that template you can now be able to notify your supervisors what are the issues. And let there not be a time where people will feel that this is a conflict between the medics or a conflict between the hospital management. This is simply the face of the governor's office for me to be able to also see, understand what the patient is actually feeling. An individual cannot be able to be spread thinly across 1 million+ patients that this county sees on a yearly basis. But with your help, we can be able to now reach out to each and every one of these patients and we see what are the issues that are there. Amongst the things that we want to make sure that are not going to be, and we're not going to be apologetic about it, we have to be deliberate about it. When a patient walks in, our greatest source of revenue and the fact that Mombasa is leading in this country in terms of SHA numbers the first thing that someone needs to be asked when they come in, do you or are you registered with SHA? So that when the time comes for them to be discharged, it is better for us to be able to deal with the debt with SHA than to start mishandling and to start detaining patients. In the event that a patient does not have that SHA cover, the Facility Improvement Fund, which was signed as law nationally, which we customized and made it a local legislation in Mombasa, Facility Improvement Fund is equally to ensure that every facility strives to make sure that we have universal health in their right vicinity. So there's nothing wrong for any one of these facilities, and that is from a level 5 to a level 4. Kindly, this is not a request, this is a command from the CEO of the county government of Mombasa. You will use the FIF to pay for every patient who comes in and they do not have SHA with them. And your job as MombasaCare is, once people have been able to get into the hospital, you will also be trained that in the event someone came in as an emergency, up to what time is it that they're meant to be registered? So that we don't have a situation where a mother has been admitted, a mother has gone and given birth, but because someone somewhere decided that, you know, the issue of registering this person is vital or not vital enough, so that person then ends up not being claimed for by SHA, and then a hospital decides to detain. The way the system actually is meant to work is, if the number of patients in the hospital has reached its optimum, the system should not even allow anyone else to be admitted. The reason why you end up seeing people now sharing beds, shameful, is because I don't know in what wisdom, and I don't know whether to even call it wisdom, where now you're saying that because this person was not SHA covered, someone else has come in and they have to be, now you're getting parents sharing. And any decent health worker will tell you that is a recipe for sharing diseases and germs. After people have already been able to be given their SHA, the other instruction that I'm giving, and this has to be absorbed by the facility, because the facility gets their employees are paid for, not by the facility, but by the county government of Mombasa. Every facility will absorb, in the event there is something that, if a child is less than 5 years old, make sure that their parents are registered with SHA. Chance is extremely high that SHA will be able to pay a decent amount. Ile ndogo imebaki, hiyo sasa every facility will account for it and say that this is the amount of money that we were able to waive for that child who's under 5. We cannot have a situation where a 4-day baby dies and we have to start asking ourselves questions. And today I wish to announce an issue of number of things that are going to be done simultaneously. As we launch this team that is here, I'm informed that we have community health promoters that have been trained already, and those community health promoters will start joining yourselves, and we feel that the numbers need to be able to increase. Even anything else, we will start by hiring those CHPs, because they know how to deal with human beings and they know how to deal with patients kuanzia huko chini mashinani. So those 60 people who were able to, those 20 people who were able to train as CHPs, let them start. And if we see through the reporting mechanism, these people now, because I met you, I think it was the day before yesterday, or was it yesterday? Saturday. And I met you and some of you indicated that you're already at the first line. So we will consider, and I've already told the Public Service Board and the County Secretary to start considering all the other risk allowances that need to be paid to yourselves so that we can be able to ensure that this gets done right. The hospital, because of my instructions that all the outreaches should now be handed over and the management of Coast General should simply concentrate on this facility here. Let the outreaches not be a financial burden to yourselves. We will take over those financial burdens for the outreaches as the executive, and the role of Coast General will just to be handled this facility. And because we have taken over all the staffing in all those other facilities that we will now be paying under the payroll of the county government of Mombasa and no longer the payroll of Coast General, you have an amount of about 60 nurses that were initially placed in those outreaches, and considering they are no longer employees of Coast General but employees of the county government and they will be placed in any facility within Mombasa, the board of Coast General needs to work with the Public Service Board to immediately replace those 60 nurses, and those 60 nurses get placed in this very hospital as we speak so that we have more medical workers in this facility. And to ensure that we do not have congestion at the SHA desk. We cannot have a situation where someone is waiting to be admitted, then we're waiting for them on that other side. SHA is taking forever because we do not have enough personnel. The other challenge that has been there is feeding of information not in the right way, where now our rejection claims end up being high. For that in mind, 10 clinical officers will have to be placed at Coast General Hospital. Their role is nothing else but look at SHA claims for the thousands of patients who come in, so that we make sure that we go and do this in a flawless manner. And as we speak right now, this week, we are finalizing the due diligence and hopeful awarding of the much awaited digitization process. What the digitization process will mean, and that process will start here at Coast General. Then we will now ask them to move to the level 4s and then level 3s and downwards. And I'm anticipating that upon awarding, which we are awarding any time now, when a patient walks in, they'll be given a digital waiting card where they can be able to press in and collect that waiting card. Now, if that patient is going to wait for a whole hour for them to go to see a nurse and triage, then that department will also be able to be answerable. How is it possible that a patient has waited for so long for them to be able to go to triage? From triage, where they're going to be given their normal vitals are taken, for them to go to see the doctor, we will digitally monitor how long it has taken for them to, from the nurses to the doctors. Mambo ya kuwa na mabroka, sijui broka na kuambia kuja uende kwa daktari haraka. You as a nurse and doctor will have to answer, why is it that a patient who came first is being served last and the person who came last is being served first? And why is it that when we hire more people, we're still seeing a situation where people are not being able to be served with the speed in which they need to be able to be served? From there, if it is to go to the lab, there'll be no more carrying of papers and taking them to the lab. You will simply press as a doctor that this is the lab tests that are needed. Let the patient go to the lab. The labs are taken, and the lab results, you do not need a broker to take those lab results to go back to a doctor. Those lab results will now be digitally sent to the gadget for the doctor at that particular place. And even more important, when the doctor is making a prescription, the prescription will be digital. You will not issue manual prescriptions unless there is an override system which will have to, you as a doctor, explain what is so special of that medicine that why it cannot be stocked in Coast General Hospital, lazima ikaende kununuliwa pale nje. Mambo ya kuchukua karatasi unampatia mgonjwa, nenda ukachukue dawa, and then from there a pharmacist says, no, this medicine is not available, everything will be digitally checked. We will need to know why that patient was not given the medicine that they were able to be given. We have to. We cannot boast. I go out of this county and every single person talks about the health facilities in Mombasa. Everyone talks about the quality of doctors that we have. Everyone talks about the fact that Mombasa treats its employees with utmost dignity. They are paid salaries even sometimes before the president of this country. But then we cannot have one facility that will ruin the reputation of a whole county. Just because kuna mabroka mmoja wawili hapa na pale. And I'm glad we have a very excellent board that is here, and they will be able to take us through on these matters, and I'm sure that they will be able to assist in bringing in that positive transformation that Coast General truly needs. I will actually be meeting the teams on a weekly basis to be getting these reports. So as the people of Mombasa judge us, and rightfully judge us harshly on this particular hospital, we will be judging every single employee based on their performances in this particular facility as well. It is the right thing for us to be able to do. The toll-free number, kwa wale wako na, and I want the Department of Media to start hyping this toll-free number. If a patient comes into a hospital, there will be a toll-free number, 24 hours, 1599. You call that number, 1599. It will give you an option. Do you want health? Is it fire? Is it any other department that you want? When you press 1599 and you press 1, it is already active. You will be taken to the Department of Health and you will be asked. We will now have from the governor's office straight to the patient what is the issues that they have, and we will now be able to be there. The governor of Mombasa cannot be there personally to listen to complaints, but I can set mechanisms to ensure that those complaints are not even necessary from a patient. So I hope everyone will be able to embrace this, and I want everyone to be able to embrace these particular programs that we have. Now lastly, in regards to this great facility that we have, I'm aware, and things happened fast, but I'm aware there was the county secretary made a decision because of a case that had been alleged that someone had died in this hospital because of lack of payment. The CEO was given an interdiction, and I'm glad that Jizan, the county secretary, did what needs to be done in a situation like that, did not act out of anything else, but he immediately put in an independent team to be able to analyze the situation. And I'm equally glad that that team has already been able to give a report. I think I saw Jazan walking in. Maybe you take your rightful seat if the seat. The team has been able to come up with, there was no formal complaint. The complaint was verbal and more. However, the council that is meant to be able to do the regulations are also going to go through that report and give their verdict on the same. And I want to state here clearly, it is unfortunate for anyone to lose their life. But what the medical report shows was that the patient came in quite unwell. And based on that, they were unable to operate on that patient because of the fact that he had a swelling that had to go down before. The CEO could be guilty in many other things. That we do not have people being discharged, we do not have this, we do not have that. But he equally played a part in building this hospital as well. As one of the oldest, actually the CEO, he's been the only CEO for Coast General Hospital. And he has opted to resign from his position. The county secretary is working on those formalities. And being a permanent and pensionable employee, considering that this report clears his name, he'll be given another role, maybe not managing a hospital, but another role. And with that in place, the board of Coast General will be tasked with working with the Public Service Board and to immediately advertise for a new CEO of Coast General Hospital, so we get a substantive CEO of this hospital. And even if it means poaching someone from somewhere, but we need to be able to get a substantive CEO of this particular hospital. And I thought it is only fair, because someone has been mentioned so many times. We're going to look at that report that has been done, and we are going to share it to the Medical Council as well, for them to go through it, so that it has a bearing of every single person. Many things might have been wrong, but causing death was not one of them. And as a leader, it is only right for me to call out when someone has done wrong, and for me to be able to say that no, this did not happen in this manner. I know that there have been a lot of upheavals between him and politicians and all, and I hope that now things will be able to cool down. We will be talking to the family so that we can bring in some solace between the two parties, and that is the right thing for anyone to be able to do. Not to be able to incite, but to try and bring solace at a time of grief. So, yangu ni kuwashukuru sana. I want to congratulate you. I'll be hoping to see. Yes. There's something else that is here. The capacity for the mortuary, our capacity is less than 100. The official statistics that we have of how many bodies are at the mortuary are about 120. That means that miili inapandiana juu kwa juu. Na mimi najua hata kama sijapata ile ushahidi kamili, lakini gavana yule ambaye kwamba kuna watu mtaani huwa pia anasikia maneno, sio? Wakati mmoja nilishindwa, nikapata mtu ananiambia, kwa gavana, mimi sitaki kazi nyingine, mimi naomba unipeleke kazi ya mortuary tu. At first I thought this man has kidogo pengine fuse imeruka. Then baadaye ndo nikaja kusikia fununu kuwa watu wanapiga dili pia na maiti. Kutaka kutolewa maiti, hata kuna wengine wanatoa maiti wakiona huko maaskari ni shida, maiti inapitishwa inatolewa kwa bahari huko. Even the mortuary attendants know this. And it's because there has never been a digital system that can be able to link in. So hiyo system ya kule inakuwa ni peke yake, mtu ana calculate. Sasa tafadhalini kuanzia leo, the management of the hospital is here. The CC for Finance is here. You work out on those paperwork. Maiti yoyote iliyoko katika Coast General, 100% watu wote waje kuchukua miili wakazike watu wao kwa njia ile ambayo kwamba inahitajika. You work out on those details, and then I'm going to state this here as well. The board work on the modalities. Muislamu akifariki anazikwa siku ile ile, lakini ndugu zetu wa Kristo sometimes they take time because kuna wengine wanataka kusafirisha miili nje. Sasa inabidi mtu akae mochari. Let us agree that it will be for a period of 7 days. That means if you die, your body will be the body of your loved one itazuiliwa kwa muda wa siku 7, sio kwa kutaka kwetu, lakini kwa kuomba kwako, ya kuwa nipeni nafasi nijiprepare gari ya kusafirisha maiti ama nini, siku 7 without any pay. Sasa ukizidisha zaidi ya siku 7, wewe mwenyewe utajua vile utalipa. So for 7 days we're going to make sure that there will be no charge on that facility for mortuary services. Na regelea tena ni charges za mortuary, na thereafter utajilipia, lakini kuanzia sasa to make sure that we have 0 bodies unless they are going to be unclaimed. Make arrangements for every single family. The hospital management knows who these family members are. Waitwe waje kuchukua hizo mwili na watu waweze kuzika watu wao kwa njia inayofaa. Naomba ruhusa niweze kuacha hapa kwa sababu niko na safari. Wakati tunafanya haya niko hapa na kofia ya Waalaikum salam. Niko hapa na kofia ya Faki. Umekuja wakati naomba nikimbie. Si lazima. Kwa hivyo I have to leave. Unfortunately nilisema kwa tuanze saa 2. Faki in a nutshell, pengine nikuelezee tu uweze kufahamu. Senator, 1, tumekubaliana ya kwa hii MombasaCare program will be there. Their role is nothing else except kuangalia hali na rasilimali za wagonjwa. 2, tumekubaliana ya kwa hospitali ilikuwa iko na mpango, wale madaktari ambao na manasis walikuwa wakifanya nje, wale wote wamechukuliwa na county government. Sasa hivi hospitali wale ambao kwamba walioko nasi 60 wachukuliwe. Tumekubaliana ya kuwa ile attrition ambazo kwa zilioko, tumekubaliana ya kuwa one of the major reasons why the hospital imekuwa na a very high rejection is because of the quality of claims that have been there. Kwa hivyo wataekwa clinical officers zaidi waweze kuingia katika hii program ya SHA, na kila mgonjwa akifika katika hospitali alipiwe SHA yake na the facility. Nimesikia watu wakisema ya kwa Coast General haipati chochote, lakini kila mwaka tunazidisha wafanyakazi ambao wanalipwa na serikali ya county mshahara walioko katika hospitali hii, na sio pesa ambayo kwamba inaotoka kutoka kwa wagonjwa ama inatoka kwa SHA. Ni bilioni 1 kila mwaka ambao kwamba tunalipia kutoka kwa pesa zile ambazo kwamba tunazipata. Tumetoa na toll free number 1599, na baada hapo una press 1 ili kuweza kupata masaa 24 huduma za kuhusiana na afya. Nimeelezea pia vile vile kuhusu Daktari Kandwala. Interdiction ni jambo ambalo kwamba siku zote hususan ikiwa ni jambo ambalo kwamba lilikoko lenye si sauti, lakini jambo ambalo kwamba la husiana na mambo ya kifo, jambo la interdiction si jambo ambalo kwamba ni geni. Na uchunguzi umefanywa kama vile unavyopaswa kufanywa. Umefanywa na uchunguzi umeonesha, uchunguzi umefanywa na county secretary na umeonesha ya kuwa Daktari Kandwala yule mgonjwa alofika hali yake haikuweza kumruhusu kuweza kufanya ile operation. Lakini what we are saying is someone might have his flaws in other things, but causing death was not one of them. And even in those flaws that someone had, someone also had his goodness that over the years they brought to this facility. So as we are quick to be able to judge a process that was merely an administrative process, as the public and everyone else is quick to be able to judge, let us also understand that now is not the time for kutoa maneno huyu alisema hivi na huyu alisema hivi. Now is a time for bringing everyone together. And I've accepted, it has not formally come to me, but I'm informed that it has already gone to the county secretary, his resignation letter, and his role will not cease to be working at the county government of Mombasa. His role will cease working at Coast General Hospital. He will be given something else, not on management of a hospital, but in the Department of Health. And as they do that, the board of Coast General Hospital will now commence on recruiting a substantive CEO. Nadhani paka hapo kwa sababu lazima nielekee Kilifi na kutoka Kilifi naenda Malindi. Leo niko hapa nimevaa kofia ya gavana. Kutoka hapa lazima nivae na kofia ya kuwa deputy party leader wa chama cha ODM. Niongee huko na niende na ndugu yangu Hassan Alijo ambaye ako na program zake kule. Asanteni sana na Mwenyezi Mungu ajalie kila la kheri. Thank you very, very much.
Thank you so much, Your Excellency. As you all remain seated, kindly